our new model Aura, which is purely a bubble Cpap ventilator for the neonatal patient. In this machine, we have so many facilities, like we have a inbuilt blender, we have a inbuilt turbine, we have a inbuilt servo control humidifier. Now for turn on the device, you have to just press this switch and press a push button. When device is start, it's doing some self check, some required self check like hardware check, data validation, sensor check. All the condition is okay, then it's going to the main menu. The main advantage is the FI2 calibration is just performed during when we start the machine. Now it is the main screen of our unit. First we have just see the connection, how we connect the, as I told you, we have a servo control humidifier inbuilt in our machine. So it is the servo control humidifier and it is the chamber we have connected with the machine. From there we have connected the heated tube, which directly connected to the port we are just giving here. It is the temperature sensing port, which is connected at the output gas temperature. It is measure the output gas temperature as well as patient end temperature. Both temperature will be measured and seen in the display. It is a normal bubble Cpap connection we are used here. It is the inspiratory port and this is the expiratory port, which is connected to the bubbler. Now we are going to see how we operate the machine. So it is the machine operating is very easy and reliable. Just you have go in the setting, and here there are three settings. One is flow rate, second is temperature, and third is FI2. As I told, the inbuilt oxygen blender available inside the machine, so you no need to connect the external blender. We have internal blender as well as turbine in this machine. So you have just doing the setting. After doing all the setting, you have just save the setting, then start therapy. So therapy started. So during the running therapy, there is some important parameter which we are seeing on the display, like flow rate, temperature, pressure, FiO2, spontaneous BPM, and therapy time, for how much time you give the therapy. Okay, another thing is, if some doctors want to see a graph also, then they have an option like view, graph plus monitoring. So you can see here some important parameter as well as graph. Another thing, in which ventilator we have a trend. So we have a trend available for last 72 hours for the all the parameter like flow rate, FiO2, pressure, BPM spontaneous, temperature, and output pressure. So for all the parameter you can see a 72 hours trend. Another advantage of this machine is in history. We have given two types of alarm history and alarm log. Like alarm history, you can see around 10,000 alarm history here, and another is the event history. In event history you can check when data or anything is changed. Like we have started therapy on 10:42, we have machine on, we have changed the flow rate, we have changed the temperature. All the log will be logged in this display. So you can see a display here. Another thing, we have given three major main monitoring display like O2 pressure, O2 line pressure. Another is the warm up. If we set the temperature 31, it reaches 31, then it is a normal condition. If it is not reached the temperature 31, then it is in warm-up condition. So you can see it is warm-up condition or it is in same condition. Another is the apnea. We have a spontaneous BPM facility or measuring facility was also available. So you can see here, if patient is not taking any spontaneous, you can just receive the alarm of apnea. Now operating, if you want to change the parameter, then same thing like go in the setting, just change the parameter. It's a very easy operating. If you want to change the temperature, then you change the temperature. If you want to change the FiO2, then just push and yes, it is starting the new parameter. So it's a very easy operating. As well as we have a O2 sensor which has a life of 2 to 3 year minimum. So it's a long lasting, we are using long lasting FiO2 sensor, as well as we are using the long lasting flow sensor, because we have given all the parameter, monitoring all the parameter like flow, like temperature, like FiO2, all the parameter we are measuring and display on the display. So we are using also a flow sensor which has a life of 5 to 6 years, and we have making it in house. It is the bubbler. You can set a PEEP from here directly. So for the pressure setting, we are using this bubbler, and in this machine you can connect any accessories. No same accessories we have purchased from us. You can connect all the universal accessories in this machine. So for now you want to just stop the therapy, you can just push the stop therapy button, and then yes, it is in standby condition.